I was a department manager in Russell, Kansas, my CEO said, a rural hospital CEO is the hardest job in America. I don't know why, but when he said that, I thought that's something I want to do. I think rural health care is a mission field. I think it's a calling. You don't go into this unless you want to serve that calling. There's a lot of ways you can make money and not have the stress and not have the frustrations, but it's also, I think, the richest mission field that there is, because you serve a community and can make a long-lasting difference.
We kind of have a motto here that if you're doing the right thing, then things will always work out. We've kind of stood by that because, as we all know, rural healthcare can have roller coasters, and sometimes when you're in those valleys, it feels like things aren't always going to go your way, and we kind of just have to stand on, if you're doing the right thing, that it's going to work out. And he's always been a champion for that, of just keep doing the right thing for the patient.
Well, you know, it's a small town hospital's a struggle. Financially, everybody's got their hand in the pockets of money in medicine, and Roger's very conservative. He spent money of the hospital like he'd spend his own money, and he's pretty tight.
Being a CEO of a small facility, you have to balance so much. You have to be a great listener because there's so many people that rely on you to stay at the helm of everything that's going on. Sometimes you have to wear multiple hats. You have to play a role in the finances, play a role in the community, educate board members, community members, and then stay that listener and that advocate for what the community needs.
He believed in us, and he believed that if we took care of people, go take care of patients, and everything else will work itself out. And he bore that burden of making sure that financially we were fiscally responsible.
You have patients that come in that need help, and a lot of places have turned them down, and he's always said, hey, take care of the patient first, we'll worry about the money later.
I think Roger's a godly man, and it shows through his integrity, his honesty, his hard work. He's straight up. I have a little thing I say to everyone around here, just do the right thing, and he does the right thing.
You can walk the halls of this hospital and ask why people work here. People that have worked here 10, 15, 20, 30 years in this same hospital, and they will tell you it's because we're family. It feels like a family. Roger created that culture.
I think of the quote that culture eats strategy. And I say that because Roger developed a culture within his organization, and certainly among his peers, as someone who really valued the work that's being done in his organization to improve health and healthcare, which is what we all strive for in our state.
Community is so important to him. I can reflect on a time where he talked about how he wanted to ensure that his team here took care of people as if they were their family.
I doubt you see very many hospital administrators do this, but he gets involved in remodeling part of the building. He worked as hard as anybody else to do that physically, gets in the middle of it, gets dirty, down and dirty.
You either hire somebody to come in, or it would be just as easy for me to put on my work clothes and say, I'm going to be out of the office working here. Staff knows where to find me if there's something needs urgent.
Roger's kind of known as the mud man because, you know, unlike a lot of other administrators, we'll do repair work or, you know, remodels, and he jumps right in there, and he's a really good drywall person.
And that's just the ability to let everybody know that no job is less important than another job. And I think that's the key to being able to everybody pitch together, and that's what I've watched so much in this facility.
And so I think that is something that's really telling of Roger, his ability to bring folks together, but certainly putting patients at the center of his decision making. You know, he has been involved in our advocacy committee for a decade and a half. He's chaired our rural health council. He has always been there when we've asked him to lean in on issues of importance to hospitals in our state.
This career would be impossible if you didn't have good family support. Sometimes it's the emotional sounding board to say, you know, maybe things aren't that bad. Maybe it's the cheerleader to say, just pick it up and keep going. If you don't have a solid family background, I don't know how you can center yourself enough to be able to take on responsibilities that happen in leadership of other people.
I'm not sure if he yet has still stopped with retirement. I think he still likes being involved. I think he has such a passion for helping. He has such a servant's heart. That is a beautiful thing that you have to have as a leader. I know that he really built a wonderful team. That's one thing I am confident in, is that he developed a really strong, stable ship and was able to pass on a stable ship. And I know that was his biggest goal, was to not walk away from a rocking ship.
I always want this facility to be successful. I always want the people that work here to be successful. So I'm proud to see what they're doing. I'm proud to see them going forward and making change, because it's not, change always is good. So for them to make changes that I didn't make, I'm glad. That's what a new set of eyes needs to do. That's what a new generation needs to do, because we've got a new generation teaching a generation. So that's just advancement.